Welcome to this talk. Now, Dr. Claire Craig, the well-known pathologist, medical researcher, data analyst, medical author, was recently asked a series of relatively poorly thought out and relatively poorly coordinated questions, but in answering them gave some really profound insights into the state of where we are at. Let's listen to Dr. Craig now. Well, we are here in Leicester Square with Dr. Claire Craig. Claire.
Hello, John. Nice to see you.
What are we doing here this evening, Claire? I'm sure there's some reason for it.
So tonight's a big night. Tonight is the opening night of the film First Do No Farm, which I'm hoping is going to have a really big impact.
So this is some sort of, I've heard of the Hippocrates idea, first do no harm. So Asim Malhotra, who's designed this title, First Do No Farm, what do you think's in his mind, sort of conflating those two ideas?
So we've had a culture in medicine for far too long where there's a pill for every ill, and doctors will introduce medicines to treat symptoms, to treat diseases, but we're very, very bad at stopping them and taking them away. And so we end up with a culture where people start taking one drug, and before they know it, they're taking drug for a side effect of that drug, and you can very quickly get into a vicious circle. And we do need to take a different look at this as a society, and ultimately the pharma industry, it suits them really well, and there needs to be some kind of counter to that that's missing at the moment.
So this idea of polypharmacy, where you can take one drug and then you take another drug, can that lead to sort of problems in the body, side effects, toxic effects, things like that?
Well, yeah, of course it can. There's I can't remember who said it now, but the principle of medication is that actually every medicine can be a poison.
Yes.
It's just that there can be benefits at the right dosage in the right time in the right person. But you really ought to be thinking of them generally as not something you want in your body. Ultimately, pharmacology, it serves a purpose. I'm not saying all drugs are bad at all, far from it. But we have to be more thoughtful about how we use them.
Do you feel that perhaps there's too much financial interest or vested interest in the way that the pharmaceutical industry influences the entire practice of Western medicine, really?
Oh, absolutely. And, our economy has got a lot invested in pharmaceuticals, and we've got to this situation where we have these huge companies that are very, very powerful and have, in their own self-interest, got influence over medical journals, over universities, over the medical education system. And so, their power is far too big, and it needs to be reined in. And it needs to be reined in from, people who are also in a position of power, because people like you and I can talk about it, but when all we can do is sort of raise awareness of it. And actually, to counter that kind of power, you need proper politics coming into play.
Absolutely. So where should we get our evidence base from in healthcare? If we can't necessarily trust those that are paying for the interventions to research their own interventions, how do we find out what works and what doesn't work, what's good and what's bad?
So we've got ourselves into a situation where, because pharmaceutical companies were running the clinical trials, the regulators and other people who are trying to kind of keep their reins on them introduce barrier after barrier after barrier, making it much harder and harder to run a trial. And what happens then is that running a trial on a generic drug becomes financially impossible to do. And it means that an independent doctor who doesn't have pharmaceutical backing and has an interesting clinical question, it's impossible for them to run a clinical trial. And so I think we have to just start again and say, look, hang on a minute. Why are we allowing profit-making companies to experiment on humans? That's not a good baseline position to be in, ethically. The people experimenting on humans need to have no financial interest. They need to be properly independent. And once they are properly independent, we can rethink trying to integrate clinical trials more into clinical care and making them much, much cheaper to run so we can be learning more efficiently.
Yeah. And I get the impression there's lots of useful things out there as well, whether it's herbs or medicinal mushrooms or lifestyle factors or nutraceuticals that would do us a lot of good as well, potentially with less adverse reactions.
Well, absolutely. And, my dad's a doctor. In his day, you would run a clinical trial, just do it over little things like that. It's interesting little things that people sort of had a feeling about, well, why not we do a trial? They're the relatively harmless things.
He'd just do his own clinical trial.
Yeah, absolutely. But that whole culture's disappeared. It's completely disappeared. It's just become impossible to ask those questions.
So do you think doctors aren't really allowed to use their clinical acumen and give medical opinions anymore? I mean, we used to say, what is your opinion, doctor?
Yeah.
I mean, do you think we need to kind of get back to that, to medical gut instinct, if you like, or the training and acumen that doctors develop over a career? Do you think that's being sort of delegated in favour of just following guidelines?
Yeah, I think it's really sad, actually. So medicine has become very protocol driven, and the doctors are restrained by what the guidelines say and do. And what it means for an individual patient is that if they aren't obviously not going to fit into the guidelines, if they can't provide proper evidence for why they don't follow the guidelines, they will be shoehorned into it, and it might not be right for them, and that's not good for patients. And I think doctors have really lost what's important about medicine, because, you know, in a world that's becoming increasingly algorithm generated, where we've got AI around the corner, doctors following protocols is very replaceable. And what the thing that doctors bring is their ethics and their humanity. Yeah. And if doctors don't start focusing on that and showing how important those two things are, then we're going to lose medicine as we know it, I think.
You're right, you can teach anyone to follow an algorithm, can't you? But I want a medical opinion when I'm sick, so that's what we need to get to. Dr. Claire Craig, thank you very much. And are you looking forward to the film?
Oh yeah, absolutely. I always like a good film.
Yeah, absolutely. Thank you. Yeah.
Thanks, Tom.
Yeah. So, as you'll have realised, that was for the premiere of Dr. Asim Malhotra's film First Do No Farm, premiered at the Odeon in Leicester Square. And it was a great event and time to meet up with some of the country's leading thinkers and medical thinkers. And Dr. Craig and more interviews to come, actually, from that, from my sojourn in Leicester Square. But this idea that there's a pill for every ill is just too ridiculous. The idea that you can do what you want and then adjust everything with a bit of pharmacology doesn't make any sense. And it's often been said that pharmacy is poison in small doses, and that's basically true, because if you give too much of anything or too many combinations of things, it's always harmful. So what she's saying here is so obviously the case. And the need for counter argument and nuance, we have to be allowed complete free speech to discuss these topics. And at the moment, quite simply, we're not. There is censorship. And I'll use the word intimidation. I've had threats on multiple occasions, significant threats. More thoughtful use of drugs. Drugs should be given for their precise indication. Now, I have often given drugs and saved patients' lives. No question about that. We need drugs, of course we do. But they should be given for a specific indication, and hopefully for a particular limited period of time. Some patients need drugs for life, of course. You might think of patients with type 1 diabetes, for example, who depend on ongoing insulin supplies, of course. But as a general principle, if I'm ill, I want to take a drug for a period of time and then stop taking the drug. That would be ideal, because all drugs, of course, have potential adverse reactions. Anything that's actually going to work, anything that can have a pharmacodynamic effect that actually brings about a change in the body, has got the potential to bring about negative change as well as positive change. And we need to monitor this and give the drugs for the correct indication, being aware of adverse reactions. And we need to be completely free to discuss adverse reactions. There should be no censorship of the discussion of adverse reactions. Dr. Craig there warned about the risks of undue influence. Are rich entities more able to speak than poor entities? Are us ordinary people less able to express an opinion than those who pay for those opinions or pay for that research? And clinical trials need to be instigated on clinical grounds. So, for example, we've interviewed clinicians working perhaps in fairly basic conditions, and they come across a clinical phenomena and they think, oh, that seems to be beneficial, or that seems to be harmful. Let's put some data together on that, rather than have lots of barriers in place that means that clinical trials can only be done by people with significant resources, well above the resources of the individual or even smaller institutions. And research on humans should be independently monitored. people that are researching on human beings, and that's what clinical trials are, people that are researching on human beings should be independent and have no subjectivity in their decision-making processes. All quite obvious, really, but Claire just puts it in such a clever way. I thought I would bring that to you, but for now, more to come. But thank you for now.